Let's talk a little bit about the popular Botox fillers. Can you just explain a little bit what they both are and the difference between the two?
Yeah, firstly, I would like to say the difference between the two because Botox is a drug which helps your muscle to relax. Now, on our face, when I'm moving my eyebrows like this, you see these lines here. These lines are coming because my muscle is attached to the skin. God made it that way so that we can express, right? So, Botox calms these muscles down. It's like giving an injection, usse the muscle calms down so your muscle doesn't crease your skin.
And it will not make us look or feel more plastic because these are common
Yeah,
things.
yeah, yeah. So if you overdo anything, it can make you look a bit odd or stiff, so to say.
Yes.
Right? There are many times, and this used to happen a lot at one point, where we used to follow guidelines and do Botox on the forehead, and the person can't raise their eyebrows then.
Yes, and that doesn't happen anymore.
It's less common. It all depends on the dose.
Okay.
So if someone, and it depends on various things about the height of the forehead and so on and so forth. So if the dose is too much, you will compromise movement, but then your effect will last longer. Some people want that.
Who's in charge? When there is an intervention being done, who's in charge? The doctor or the patient?
I would like to believe the doctor.
Okay. Well, but what's happening? What's happening in reality? Because we see
I think
things...
I think there's a lot more talking going on in clinics nowadays, especially with these things. See, when you're giving your face into someone's hand, you're concerned, and I completely understand that.
Yeah, it's a huge level of stress.
So I think it's better that you talk.
Yes.
You should clear these things out.
Yes.
And I tell my patients this, that some of them, they may not understand. They say that lines itni jaldi wapis aa gayi, Doc Saab. So I say, okay, but we decided that we will do a subtle job, something which will make your movement stay in place. So it's better to communicate this early on because it's a relationship and it's not one procedure, right? I need to make sure this person is comfortable, happy walking out of my clinic after what I did for them. So, and the way they look.
Yes.
And, in the oath you take for medicine.
Do no harm.
Do no harm.
Do no harm.
And do no harm in many ways.
Yes.
Not mentally, not physically.
Yes.
So I think you need to remember that this person needs to look normal as well, right?
Aesthetics is a tricky thing, right? I think we need to have a whole different podcast on aesthetics, but it's a different thing because the perception keeps changing. Like I hear from people that once you begin, you cannot stop because your expectations from your own face have changed. I don't even know what that means, but
that's not so true. See, I get Botox now. I've not got it. I have lines. So I get them because I have horrible lines sometimes. So it's fine. If you don't do it, it'll be back to square one. But it's not
so you can stop.
Yeah.
You can.
Of course you can stop.
Not, but perhaps you don't want your face to look the way it used to.
Yeah, perhaps you sort of start liking the way you're looking after doing it.
And then, but
that's
there are
possible.
Cases where one sees people and you think
when
this person
things
is
have
looking
gone
so
downside.
Odd, yeah.
Yes,
and,
I think it's the doctors.
Unreal.
That's what I meant by the oath part. That it's the doctor's responsibility to guide the patient well and tell them that okay, today we're not going to do treatment. Because I think it's enough.
But that's very important what you're saying because a doctor turning away a patient and saying, I'm not doing it requires a high degree of ethics, right?
Yeah, not only, and more than ethics also, see, it's at the end of the day, it's also business for you.
But that's exactly what I'm saying.
That's it. So you need to tell your patient that because reputation is equally important, right?
Yes.
So that...
the long game.
Yeah. So doing something wrong there and patient not looking great is going to spoil it.
Yeah, that's true. And also, okay, and coming back to fillers, you said Botox is what we put in to relax the muscles. And fillers?
Fillers are more for filling lines. But mind you, I think this is a misnomer. Fillers don't just fill.
Mm-hmm.
That doesn't mean everyone's looking plump. You can use fillers to thin down a face as well.
Okay.
If placed in the right place, in the right quantities. So if I want to give a slight lift, I want to chisel the jawline, enhance the lips, nose, so on and so forth. That's what fillers are used for.
And is there a particular age where you think one should start or is it even necessary?
No, nothing is necessary.
Yes.
These are elective procedures.
Yes.
So it completely depends on the person whether they want to go down this lane. If someone is petrified of needles and they don't want to go down this
Yes.
lane, there are simpler options also available. And honestly, there is, because of what you just said, so many of these photographs, celebrities, people that we see, there is somewhat a filler fatigue, somewhat creeping in,
It's a bit
which
scary.
I'm seeing.
Yeah, it's a bit scary.
And people want to now do treatments which are subtle, more natural, and then make them look normal but fresher.
Yes, that's
And that's
well
a
said.
segment which comes in there,
That's
which
well
has
said.
these things which are available to do.
So what are these procedures which we can do, which are
So-
non-invasive or
So let's say a high intensity focused ultrasound, that's called a HIFU, a micro needling procedure, just a collagen induction. You want to go slightly across the border, then something called skin boosters.
Acha. What are
These
those?
are hyaluronic acid, but they are not going to change anything on your face like a filler.
But you're not
They're
putting
the
them
same
in?
family. You are putting them
you
in.
are needling.
You are putting
Okay.
them in. But they hydrate your face. They
Okay.
give that dermal homogeneity, which I
Okay.
was talking about. So you get a nice, hydrated, supple, soft, smooth skin,
Okay.
which looks fresher.
And how long does this last?
Typically, claims are 6 months.
And
It lasts for at least 4 to 6 months.
that's pretty decent. That's,
Yeah. And so a lot of people now have moved to these sort of modalities.
okay. Yeah, because it's more conservative and probably the downside of...
Yeah, and that's what. So everyone sees these things and they
Yes.
feel that we don't want to look like that, right?
Yes, yes.